When it comes to the benefits of Ozempic, obviously weight loss is a huge one. I read recently something about heart disease and potentially preventing against heart disease if you're on Ozempic. Is that true?
Yeah, it's true.
So because you're not putting on as much weight, I'm guessing.
No, there's a good question. So I've written probably one of the. You don't want to be, I've written a paper which completely, exactly addresses that. The evidence thus far is that this group of drugs, well, certainly Ozempic or semaglutide, its effects in protecting against heart attacks and strokes may not be through its weight loss effects, but we're not completely sure. The evidence in people with diabetes with these drugs is that they do protect against heart disease in a way that's not weight dependent. So we think that these drugs have a direct effects on the blood vessel lining of the heart, so that the blood vessel lining, when it gets rough, it's more likely to attract cells to lead to the plaque. So these drugs, Ozempic, is helping the blood vessel lining stay smoother. It's helping platelets, which is one of the blood cells that causes clotting. It's stopping them become dysfunctional and sticking more often.
Right.
So it's affecting various tissues and cells in ways that stops plaques developing, we think.
Is it almost like a blood thinner?
Oh, no. That's a good question. I don't. It's not. It's not quite as that. But when you lose a lot of weight, it will partly reduce the ability of the blood to become clot. And the way I say that is that we know that obesity is linked to more what's known as things like deep vein thrombosis, which is basically a blood clot in your veins, or pulmonary embolism, which is a blood clot in your. Obesity is linked to that. And one of the reasons why is back to the fat in the liver. When you get too much fat in the liver, you're also making more factors like that cause clotting or affect that thrombotic process that causes these these blockages to happen. And when you lose weight, you lose fat in the liver, but some of those proteins go back to normal again.
Okay.
So the blood is less sticky.
Yeah.
Or its stickability is less. So you're less likely to get some of those blockages happening.
Okay.
And that actually seems to be true.
Right.
Or trials are looking into that as well at the moment. And actually there's some bits of evidence that that's true. So so there's definitely something about this drug. So its effects on the heart may be both through the direct effect of the drug directly on some cells, but also indirectly through weight loss.
Yeah.
So and it may be that you only see the latter when you lose enough weight for that signal to be big enough. And that's something I'm trying to explain to some of my colleagues. And but the weight loss effect is the key thing for diabetes. Well, not diabetes, but it's the key reason why you get benefit on sleep apnea, osteoarthritis, fatty liver disease, heart failure, high blood pressure. Whereas the heart attacks and strokes is probably more, it's less weight loss, more direct effect. So again, for different outcomes, it's a mix of weight loss for some is the dominant. For others, a few, it's probably a combination of weight loss and the direct effect of the drugs. And we didn't anticipate that would happen.
Yeah.
No one, when we first did these trials, they did the trials. The first trial was called the LEADER trial. It was to prove that this drug was not increasing the risk of heart disease so that we could use it in diabetes, but was still protecting against diabetes. And lo and behold, wait a second, wow, it protects against heart disease. How did that happen? Yeah.
So I suppose that is one fallout effect of is branding it as a whole Ozempic that's potentially a positive. What are the long-term effects of Ozempic?
Well, it depends what you mean by long-term. So
2 years. Let's say I'm on it for 2 years and then I come off of it. Is there effects that continue after my stop of usage?
Yes. Is there what's known as a legacy benefit? I'm guessing here because no one's done those studies. During those 2 years, right, where you were on it, your weight was a lot lower. Your blood pressure was lower. Your blood fats were better. Your fuel quality was better. There was less volume in your system. You were pressure, and all of that means that all those, it means that your tissues and your organs were seeing better quality fuel, less fluid pressure, and therefore the pumps and pipes and filters of your body have undergone less aging.
Yes.
So that means my guess is, and also in addition to that, you've got that direct effect on the heart in terms of protecting against heart attacks. So you probably have added a little bit of a reduction in heart attack risk. You've probably delayed, if you were going to get heart failure, risk of heart failure. You've probably delayed, if you were going to get kidney disease, your risk of kidney, you slowed your risk of load of kidney disease. You reduced your risk of fatty liver disease. So it probably has got a legacy benefit, yes. But it's probably, and that legacy benefit depends on how much weight you lost and for how long.
Yeah.
It's area under the curve.
If you guys enjoyed that clip, please do me a huge favor before you go and head over to our Into the Mind podcast official page where we have the raw, uncut Into the Mind podcast, and hit that subscribe button. And the more subscribers we get, the more incredible guests we can get on the show. I really appreciate you guys for watching. Thank you so much. And I'll see you all real soon.